Good morning. Thank you, Premier. So since February of this year, we've administered well over 8 million COVID vaccinations in New South Wales, and another milestone was achieved this morning. We opened our doors to children aged 12 years and over at our hub, and I can tell you it was a delightful thing to see those children in our queue at the hub this morning. As part of the statewide vaccination program, St Vincent's Hospital vaccination team has been working tirelessly over these months to ensure equitable access to vaccinations for vulnerable populations across our broader community. Last year, our homeless health, mental health, and alcohol and drug, disability and aged care services identified the exceptional risk these population groups faced under the threat of COVID. And we saw firsthand the devastating impact on residents and their families when COVID took hold in facilities. We knew that providing vaccinations was the only way to ensure the ongoing safety of our patients who bear additional risks with COVID. Nearly 5 months ago, and I'm so proud of this, we opened our first targeted homeless health and social housing hub down in Woolloomooloo in partnership with St Vincent de Paul, Kirkton Road Centre, the City of Sydney and specialist homeless health services from across the local area. And since then, we've provided more than 5,000 vaccinations to those who are most vulnerable in our community. And I have to say, it's one of the greatest achievements I think I can stand here and talk about from a personal perspective. Our Vinnie's Vax Van was an idea born from a conversation held at this hub. When vaccine hesitancy was at its peak across the broader community, this hub saw people turning up in their hundreds week in and week out because they knew that vaccination was the only way to keep themselves, their loved ones and their community safe. And so we knew that there was appetite out there for people to receive COVID vaccinations. But we knew that not everybody was going to be able to access vaccinations through our standard mass vaccination hubs and other clinics. And whether that was reasons of cultural and linguistic difference, whether that was due to poor mobility, physical disability, chronic health conditions, or people who aren't able to leave their houses, we knew that we needed to reach them instead. I was very fortunate to be able to reach out to the Curran Foundation and the Suttons family, who very quickly supported the idea, understood the importance of this work and provided us with our first Vax Van, which has now been extended to 2 Vax Vans. We've travelled across Greater Sydney, vaccinating residents and staff in residential aged care facilities, young people with severe disabilities and supported accommodation and their carers, people who are bedbound and unable to leave their homes, along with their families who have lived with the fear of passing COVID on to their vulnerable loved ones. We've provided vaccinations through hubs and from our Vax Van for people living in temporary accommodation and hostels, those people who have been further isolated throughout this pandemic. And we've been able to respond to areas of concern at short notice, including deploying teams into Parkley Prison to administer vaccinations to inmates and staff there. Are we unique? Not at all. I stand here representing the thousands of people who are out there in our vaccination programs across the state who are doing everything they can to rapidly protect our broader community. Why? Because we know that vaccination is the only way out of this. It is the light at the end of the tunnel. And especially for my colleagues who are on the floor day and night at the moment, dealing with the ravages of COVID as it affects more and more people across our community, we are working relentlessly at the other end of the spectrum trying to protect those who are in our community, but also to protect our colleagues who are working on the front lines. And there are thousands of us working across the vaccination program, and I wanted to give a quick shout out to them because it's not just the doctors and nurses, it's the pharmacists, it's the techs, it's the IT support, it's the cleaners, it's the wayfinders, it's security. There are literally thousands of your New South Wales compatriots out there working hard to keep the community safe. And this vaccination program is so immensely complex and relies on so many moving parts, all of them people. And all of them people who want that light at the end of the tunnel to get closer and brighter every single day. So for everyone out there watching who hasn't been vaccinated, I cannot ask you strongly enough to please reach out to your primary healthcare provider and have discussions if you have concerns about vaccination. Reach out to your local health centres, reach out through New South Wales Health website, the New South Wales Government website, Health Direct, to make your vaccination appointment. Come down and see us at our pop-up clinics, our outreach clinics, all of which can be found on the New South Wales Health website. If you are having difficulty accessing a COVID vaccination for yourself or for somebody you love, please contact Health Direct so we can find you out there in the community and provide you with the protection that you deserve. And to our Aboriginal and Torres Strait Islander communities, my health colleagues and I understand the absolute urgency with which we need to provide you with that protection. So this week, and as part of our ongoing commitment to protecting all of our communities, we are holding specific pop-up clinics across the state for Aboriginal and Torres Strait Islander people aged 12 years and over. For everyone else, my final comment is please get vaccinated, please be part of the solution, and please help end this pandemic as quickly as possible. Thank you.